Good morning everyone. I am Aaleha Izza Baliwan from BSN 1A. And now I am going to do a return demonstration for abdomen. The first thing that I will do is to check the patient's chart. Good morning ma'am. I am Aaleha Izza Baliwan and I will be your student nurse for today. Next thing is I will sanitize my hand to prevent the spread of infection. And then I am going to identify and explain the procedure to the patient for a better cooperation. So, ma'am, I am going to assess your abdomen. So, I am going to inspect, auscultate, percuss, and palpate your abdomen. The next is provide the patient privacy. So I already closed the windows and the door to minimize the embarrassment of the patient. Now I am going to position my patient in a supine position. Here it's already. Now I am going to inspect the abdomen of the patient. I am going to ask the patient about their last bowel or reducing constipation, and if they have any problems with urination, and if a patient is a female, ask when their last menstrual period was. So, when was your last reducing constipation, ma'am?
Yesterday.
Okay, so yesterday. So, do you have any problem in urination?
Yes.
When was your last menstruation?
Last week.
Okay, so thank you, ma'am. And now, I am going to inspect the stomach contour scaphoid, if it's flat, rounded, or protuberant. And then I will note pulsation at the aorta. Noted in the patients, the aortic pulsation can be noted above the umbilicus. Inspect for characteristics of the navel, if it's invert or everted. And also inspect for masses. Check for the hernia after auscultation. So now, I'm done with inspection. So I am going to auscultate with the diaphragm of the stethoscope for bowel sounds. So I am going to start in the right lower quadrant and go clockwise in all the 4 quadrants of the abdomen. So now I'm going to use the diaphragm of the stethoscope. So we should hear 5 to 30 seconds per minute. If no bowel sounds are noted, listen for full 5 minutes. And now, document for normal, hyperactive, or hypoactive. So as I auscultate, I didn't hear any abnormalities and it was all normal. So now I am going to auscultate with the use of the bell side of the stethoscope. Now I am going to auscultate for bruits or vascular sounds with the use again of the bell of the stethoscope. So I'm going to listen in the aorta. It is slightly below the xiphoid process midline with the umbilicus. And for the renal arteries, go slightly down to the right and the left of the aortic side. So in the right renal arteries, left renal arteries, and the iliac arteries go few inches down from the belly button at the right and left sides to listen. So these are the iliac arteries, the right side, and then the left side. So for femoral arteries, it is only assessed if it's needed. So now after auscultating, I am going to palpate the abdomen of the patient. So I am going to do a light palpation and deep palpation. So now for the light palpation, the only 2 centimeter, and we should feel soft with no pain or rigidity reaction from the patient. So now I am going to palpate. So mom, do you feel any pain?
No.
Okay, so now let's let's now do the deep palpation. So for deep palpation, 4 to 5 centimeter, and feel for any masses, lumps, or tenderness. So now I am going to, mom, I am going to do a deep palpation. So now, as I palpate the patient did not feel any pain, and as I do the palpation, there's no abnormalities. I didn't feel any abnormalities. I didn't observe any abnormalities. So it's all normal. So ma'am, all of your as I assessed your abdomen, it was all normal. And then if ever you feel anything, so you can just come back and let's do a assessment for your abdomen again. So ma'am, thank you for your cooperation, and so that would be all for my written demonstration for abdomen